your parents. You're not your parents.
Welcome, everyone. Hopefully everybody can hear and all of our guests on Zoom can hear well. Good evening. I am Vanessa Maniago. I am the Vice President of Strategic Implementation and Engagement and the hostess of this series. This is now our 9th year. So we're very excited to see you. We have one more event this December, and then we have just produced for you our flyer for next year. So all of those events are planned throughout the end of 2025. So what we're going to do is we're going to hold our questions, if that's okay. And at the end, we'll take questions, and I'll be monitoring the chat for any of the guests that are on Zoom for them to put their questions in the chat, or they're welcome to unmute at that time and ask any questions they have. It's just that the recording, which we do, that is saved to the website. So anyone can come back and watch this again, because this is pretty, this is a lot of content. It's heavy content. So if anybody needs to see it again, this recording will be posted to our website. But that's why we need the mic, because without the mic, those questions are not recorded. The audio is not heard. So with that, before we get started, I'd like to introduce Craig Fraley from Clark County Credit Union. Craig and Clark County Credit Union have been a partner with this series since its inception, and without them, we wouldn't be able to do what we do. So please give a warm welcome to Craig and Clark County.
Thank you, everybody. Some of you heard this before, but I'll repeat it real quick. We are the medical field credit union, and we are very proud to sponsor all of Roseman's events. And if you have an allergic reaction to banks, we are the cure. And I left some magazines and some other stuff out here, so feel free to pick that up on your way out. Just a couple of things I want to highlight. When you join Clark County Credit Union, you become an owner. We are owned by our members. We are not for profit. Also, we pay the highest interest rate on some deposits in the country. We have a checking account up to the first 25,000 pays 5.13%, highest in the country on a checking account. We also have a CD, a 3-month CD, pays 4.9. The APY on that is over 5% when you let it roll over. So those are some great rates on some great products that we have. So check us out whenever you want. Have a wonderful evening tonight, and thank you all for showing up.
Thank you. Thank you, Craig. Can you hear me? Okay, great. Well, I am so proud of the work that the Medicare Call Lab does. It's an incredible community resource, and it was started in 2015. And with the start of the Medicare Call Lab and through the time that it has been working and serving our seniors, there's been an incredible amount of money saved for our seniors, but I'm not going to give away that amount yet because that comes in the presentation. And it's really a staggering number and something that all of you should be incredibly proud of. And I am incredibly grateful to be a part of an institution that is doing such good work for our seniors. So I'd like to introduce all of these wonderful presenters, and one of our presenters that is on Zoom, Dr. Leanna Oswald, Associate Dean for Academic Affairs and Assessment, Associate Professor of Pharmacy. She's over there. Dr. Michelle Hun, Director of Student Affairs, and both of them actually are Roseman alumni, which is really pretty spectacular that our alumni come back. They do incredible work and come back and serve the institution. Teresa Rawlins, who is on Zoom, and you'll meet her in a minute, is an L3 Medicare Associate Program Counselor, and she works with Wayne Young, there's Wayne, who does the exact same thing. Our incredible students here that I just want to make sure to acknowledge. Robin Reed is a 2025. There's Robin. She is going to be a pharmacy graduate in 2025. Roy Franco, where are you? 2026. There's Roy. Christian Valencia, 2026 also. Charlene Tan, 2026. Kelly Chung, 2027. Lexi Van Stone is an MBS graduate from class of 2024. And then finally, I just wanted to acknowledge Richard. Where's Richard? There's Richard back in the back. And Richard is here with some of his supplies and information to help with the Medicare process as well. So with that, I am very proud to introduce and hand over the mic to Teresa Rawlins.
Hello, I am excited to be here with all of you this evening. And I'm going to be presenting some different things about the basics of Medicare. So we're going to go at a little bit of a clip of a pace today because many of you have seen some of these basics before in our presentation, and we're excited tonight to take a unique twist on this in a little bit. So after these first few slides, we're going to have a special opportunity to hear from some of the students. But first, I'll remind you that as a Medicare Assistance Program counselor, we have an umbrella. MAP of Nevada is an umbrella over 3 different programs: SHIP, SMP, and MIPA. The SHIP portion of our responsibilities is counseling about Medicare, sharing with you questions to the complexities and comparing plans, helping you actually do enrollments. The SMP portion is the preventing Medicare fraud and that keeping your Medicare number safe. And the MIPA portion is the portion of our responsibilities when we point low-income beneficiaries to the subsidy programs that are available. So those are the 3 hats that we wear in Nevada as MAP counselors. Here is what a Medicare card looks like. Medicare Part A and B are pictured on this card. That's a paper card, and we'll be hearing more about that, but I wanted to give you that visual. Thank you. So Medicare was initiated in 1965. It was not intended to pay everything of someone's healthcare costs, and it's largely for people 65 and older and those on Social Security disability who are younger than 65. And at this point now in 2024, we have 67.3 million people on Medicare. So many of the community members that you know and work with are working with Medicare. This is a slide that shows you that in Nevada, we're almost at 600,000 beneficiaries throughout the state. It's been the 59th year of Medicare. And again, many of your family members and neighbors are Medicare beneficiaries. We like to highlight the fact that the 7-month period when you first turn 65 is when we would love to speak with you. That is an important initial enrollment time. And so we kind of put a star on that and say, please call us. Please seek out the proper information prior to your birthday, because there's a lot of guidance that we can give you. Here is a reminder of the alphabet letters that can be confusing with Medicare. So on this slide, you see we have A, hospital, B, medical, and D for prescription drugs. We'll go into those a little bit more in detail. Hospital is the part of Medicare. Part A covers hospital. And additionally, it covers skilled nursing facilities, rehab facilities. Part A is the hospice portion of Medicare, as well as the home health portion following a stay in the hospital or following a time in rehab. That's what is covered by Part A. Then Part B is almost everything else medically. Doctors, services, going to the lab, getting an MRI, having home health for an ongoing need rather than just after being in the hospital. Many preventative services are covered by Part B of Medicare, and durable medical equipment is, so a great deal is covered by Part B. And then lastly, Part D for drugs, the medications, the prescriptions that you need for your health are covered by Part D of Medicare. Now, this is a reminder of the eligibility. At 65, someone can be on Medicare, is expected to be on Medicare if they're a U.S. citizen or have been a permanent resident for 5 years. And Part A, you may know, is free. The premium is free when you've worked 10 years in the system. 40 quarters of working and paying into the tax system allows you to have Part A premium free. And also being married to someone who has worked and paid into the system qualifies you for that. The Social Security is the entity that you call to enroll in Medicare. It's not Medicare that you call. Social Security is the entity, and then they will give that information about your enrollment to Medicare. Now, one of the questions that we spend a fair amount of time talking with beneficiaries about is when they should sign up for Part B. Assuming someone has taken Part A at 65, there's a choice sometimes if Part B should be signed up for at that same time. And what the consideration is if you still have active coverage. Many people now in current times are working beyond age 65. And so if you do still have active coverage from an employer, not retiree coverage, not COBRA, not veterans, and not a marketplace insurance, but active employer insurance, then that's your choice. And you can talk to your HR and work out the details, but then you would be able to consider if you would like to keep employer coverage and defer your Part B. The other consideration with signing up or deferring Part B is that it isn't free like the Part A is, even if you have work credits. We have just learned yesterday from CMS that the amount for the monthly premium in 2025 will be $185 a month. That's the base premium when you make less than $106,000 as an individual. If you make more, then you pay more, and we'll talk about that in a little bit. The deductible for 2025, this is a little bit of a change, has gone to $257. It's been $240 this current year. So just the reminder that that's what Medicare costs if you're deciding between keeping employee plans or going to Medicare. So you would pay those 185 times 12 plus your deductible before you would be getting medical services paid for you. And then after you've paid the premiums and the deductible, you would be still responsible for about 20%. Medicare generally covers 80% of the medical services. And then, of course, you've got free preventative services. Now, when it is time for you to be on Medicare, one of the biggest choices that you make is how you want to get that coverage. There are two options. One is Original Medicare and the other is the Advantage Plan. And this graphically shows that Original Medicare is made up of some different parts. You've got your A and your B. You've got a D that you need to add on. You need to add D to your A and your B, all of these alphabet letters. And then you also, if you're choosing Original Medicare, it's important that you add on a Medigap or a supplemental coverage. On the other side of the coin is the Part C. That is synonymous with Medicare Advantage. Part C means Medicare Advantage. And in an Advantage plan, A and B and D are wrapped together. Whether it's an HMO or a PPO, those are wrapped together.
On the script will get to and from work.
Okay, thank you. Now, in making that decision between whether you want to choose Original Medicare or a Medicare Advantage plan, there are three things that we say to consider: your health, your budget, and your lifestyle. So that's when we would talk with you individually about what those circumstances are for you. Those are the considerations, and we won't go into it now, but that's what we would visit with you about when we have the opportunity to counsel with you. The next slide shows a graph with some of the basic comparisons that we'll go briefly through. So on original Medicare, that's Medicare providing the plan. Whereas in an Advantage plan, a private insurance company has been given the authorization to administer your health care. As far as providers, on original Medicare, almost everyone accepts original Medicare. So you can go to any provider, go directly to a specialist. Whereas on an Advantage plan, you need to pay attention to who is in network for that plan's contract. And you often need to get referrals to specialists from primary care physicians. In regards to Medicare's premium, you're going to pay it in either case. Yes, on original Medicare, yes, on the Advantage plan. Occasionally, the Advantage plans give a little bit of a rebate. That's becoming more rare, but it's not unheard of. And then the Part D coverage, absolutely, you need to add it on with original Medicare. With the Advantage plan, it's wrapped in. As we talked about, it comes in a bundle usually. And then supplemental insurance, yes, you need to add that with original Medicare. And no, you would not add it with an Advantage plan. That's illegal to have an Advantage plan and a supplemental plan simultaneously. This is just a picture of what that looks like when you've chosen original Medicare as far as what cards you're carrying. You're carrying your red, white, and blue card. You're carrying the supplemental card that you have asked for and are paying for in a monthly premium. And separately, you've added a Part D plan, so you're carrying a Part D card. So you're presenting these cards at the appropriate providers. In contrast, when you've done a Medicare Advantage plan, one card is the same for the pharmacy, for the hospital, for the doctor, and you've set aside your red, white, and blue card for the time being while you're using the Advantage plan. Okay, these are the brand new figures for IRMA, the income-related monthly adjustment amount. That means when you make more, you pay more for Medicare. Medicare does a 2-year look back. So now, as we move into 2025, you're looking at what your income tax return was in 2023. And I'll let you look at this graph for a minute and just see where you fall. These would be an additional amount that's added to the base premium that you would pay to have your Part B medical. Then the next slide shows similarly what is added to Part D. Both of those have an additional amount when you make more than $106,000 yearly. So that's a consideration as you're determining your Medicare and if you're staying on an employer one or if you're going to this. You're going to pay those additional incomes whether or not you're on original Medicare or a Medicare Advantage plan.
One that really got my parents, I always like to share with everyone, was when they took out some of their 401k savings to do some stuff, take some trips and do some things. 2 years later, that kind of hit them for what they were paying because it counted as their income. So just as you're thinking through when you're accessing resources, if you have them, that 2 years later, it kind of creeps up on you.
Great example. Now there's just a couple of things we're highlighting in addition to the cost changes that we've been notified about for 2025. Next year, this is a new part of the law where the Advantage plans are required to notify their beneficiaries right there in the middle of the year during the summertime what else they have left to use. As you may know, the Advantage plans like to offer additional benefits that original Medicare doesn't have as part of their framework. Silver sneakers, gym memberships, over-the-counter products like vitamins and dental benefits. So mid-year, a beneficiary on an Advantage plan would hear what they've used and a reminder of what they still are able to access for the rest of the year. And this is an opportunity for us to encourage you to consider the electronic adoption of your Medicare information. There's an effort to help you realize that you could electronically adopt to see your Medicare and You handbook instead of being one of the 50 million Medicare and You books that's being mailed out. And similarly, those Medicare summary notices that come quarterly to Medicare beneficiaries, right now 200 million of those are being mailed out. So that's something you can do on your Medicare.gov account to save the cost of mailing and help the environment. Okay, so we have come to an important part of our program with Medicare Part D. We've spoken of those alphabet letters, the A, the B, the C, and the D. And tonight we have the special opportunity to visit the pharmacy, if you will. We're going to specifically talk about the prescription part of Medicare. Before we do that, Dr. Oswald's going to share with you the history of why we even have these great white-coated students in front of us who know about pharmacy and know about Medicare.
All right. Thank you, Teresa. And thank you and welcome everybody for being here. I will point out that I'm wearing a Spider-Man shirt. Some of you might notice that. It is a fun reminder and a sad reminder. My brother-in-law passed away 10 years ago today, and he was a big Spider-Man. It was unexpected, and it was a blunder in the healthcare system, which is something that I also enjoy sharing with our students, and hoping that if you are taken care of by one of our Roseman students, or one of your loved ones is taken care of by one of our Roseman students, they will do right by you. That is our goal when we're teaching them. In terms of being here tonight, love to share that I graduated in 2007 with my pharmacist degree and started working in our community pharmacies as a pharmacist. Does anyone know what happened in 2006 with Medicare? No? Part D started. So before 2006, you didn't have drug coverage if you were on Medicare. You were paying for your drugs, or it wasn't a funded program by Medicare. You could buy different plans. Well, Part D rolled out, and I didn't know anything about it, nor did any of my pharmacist friends. And that's because we didn't get a lot of training on it in school. And in healthcare, we spend a lot of time focusing on ways that we're going to take care of you, pharmacists, doctors, nurses, physicians, but we don't spend a lot of time learning about the insurance that is going to pay for you to be taken care of. And so it is not uncommon that you have a provider who's trying to do really, again, right by you, but doesn't understand fully how the insurance might pay for something, might not pay for something, could pay for something less expensive, and the impact that that could have on your care long-term as you become more stressed because you have higher medical bills. And so that became a passion project of mine that I feel very proud about, that Roseman has embraced. The state of Nevada has embraced, the Department of Health and Human Services supporting us, and Dignity Health have embraced, that we now provide trainings. We provide trainings to our students. We provide trainings to pharmacists that are already out there, technicians that are working in the pharmacy field, and the lay public. So if you ever want to come to one of our trainings, if you're interested to be like Teresa and become a level 3 counselor for the state, we have a training program on the weekends that starts to certify people to be able to provide this service to others. So if you're looking for a project to volunteer in, that's an opportunity as well. Our students embrace it. You're going to learn from them tonight. They're fantastic. And I think they're going to be better providers for you when they graduate, because they take the time to learn about Medicare, learn about low-income subsidy programs, learn about things that will impact how they can deliver care. This is a great picture of our call center and some of the students that are working in it. We're located on the Henderson campus. And some of the benefits that we also provide is that we can do Saturday calling, thanks to Wayne, who's here, and our students. And we kind of work outside of some of the business hours, if that's something that works better for you as well, to get some support or have some questions answered, or maybe you have, a loved one that helps you navigate this system, but they work during the week, then we can follow up with you on the weekend. All right, Teresa.
We are visiting the pharmacy tonight for a specific reason, both because we've got these amazing students who can share with you their expertise of what they're learning in their education and in their internships. Also because Part D does have some major changes for 2025. So we want you to listen carefully while we go to the pharmacy counter. We're going to role play some scenarios and you'll be able to get your questions answered. First, we're going to watch Kelly go visit her pharmacist, Roy. The pharmacist is sometimes the individual who shares with the beneficiary that they don't have Part D and they need it. Let's watch.
Hi, good evening. How can I help you?
Good evening. Hi, so I'm here to pick up my prescriptions. And I know I have some medications for my diabetes. I have some medications for my high blood pressure and also some for my asthma. I think there's around like 5 medications.
Okay, I can help you with that. Did you have your insurance card?
Yes, 1 second. I have a few cards over here and here you go. I just turned 65.
Okay. Let me see if I understand correctly. So you're new to Medicare, but it looks like you haven't yet enrolled in a Part D plan. You're more than welcome to pay cash for these prescriptions, but I would strongly recommend you sign up for a prescription drug plan.
Oh, okay, I see. Can you explain a little bit more for me?
Yeah.
I'm so new to this.
Sure. So when one turns 65 or when someone obtains Part B as in boy for the first time, the government requires you to sign up for a Part D plan to add to your Medicare Parts A and B plan. That's called your initial enrollment period. So it's 7 months long. It starts 3 months from your birthday month itself, and then 3 months afterwards. If one doesn't sign up for a Part D plan, a late penalty fee starts to accrue, and you'll have to pay that every month for the rest of your lifetime once you do sign up.
Oh my gosh, that does sound very serious. I don't want to pay out of pocket since these medications are expensive, as I know. So I do need to sign up for a Part D then. Wait, my birthday is 4 months ago. Oh no, I missed the enrollment period. What do I do now?
That's fine. So if you miss the initial enrollment period, you can sign up during the annual open enrollment period. It's October 15th to December 7th, and then your Part D plan will take effect the following year. There's 2 ways to get this. So the first way is through original Medicare, where you purchase the Part D plan by itself,
Mhm.
or you can enroll in a Medicare Advantage plan.
Mm.
And if you had any questions, you can give the Nevada Medicare Assistance Program a call, and we'll answer any questions you have and give you unbiased information.
Okay, thank you so much. I'm glad I talked to you. And I'm definitely give them a call to seek some help on helping me enroll.
All right, thank you.
Thank you.
Thank you, Roy and Kelly. These next couple of slides highlight a couple of the things that they went over. That's the reminder of your 7-month period. That's the reminder of when open enrollment is. And that's the reminder that your D could either be in its standalone prescription drug plan or as part of an Advantage plan. I've actually worked with 4 beneficiaries personally this last month who didn't have Part D and had a 17 or 18-year penalty because they had not obtained it. So that's why we want you to not face that. Okay, in Nevada right now, just back to that one slide. Thanks. In Nevada right now, there is a $0 plan. You can see there's a big range from 0 up to $145, $155 Part D premiums. Those are the 14 prescription drug plans in Nevada right now. Wide range of choices, and we'll help you see what's best for you for your own medications. Okay, now we're going to see who else needs pharmacy assistance. I think Wayne is headed to see his pharmacist, Charlene.
Hi there.
How are you doing today, Wayne?
Great, thanks. I'm really hoping to avoid a horrible, miserable winter this year with the flu. I'm 68 now, and it's just getting harder to stay healthy.
Well, I'm glad you asked. I'm glad you came into the pharmacy. I can tell you about some of the vaccinations that we can get at our pharmacy. And since you're a Medicare beneficiary that has Medicare Parts B and D, you can get these for free. So for Medicare Part B, it covers preventative services such as our annual flu shots, COVID-19 vaccines, pneumonia vaccines, and if you're high risk for hepatitis B, the hepatitis B vaccine as well. They also, or Medicare Part B also covers like vaccines that are used to treat illnesses that are directly related to like being exposed to a disease. Medicare Part D covers all other vaccinations that are recommended by the Advisory Committee on Immunization Practices. So this includes the Shingrix shot for shingles, RSV, Tdap for whooping cough, and many others. But as of 2024, these vaccinations will be available to you with no copay and no deductible.
Wow, that was a lot of information. That is
Yeah.
so great. So can I get that here, or do I need to contact my doctor?
Well, you can get these vaccines here at the pharmacy, but once you get the vaccines, our pharmacy will update your immunization record on Nevada WebIZ. That way, all of your healthcare providers, which includes your primary care provider, can access this record and see what medication or what vaccinations you've gotten and when you've gotten them. Also, another note, you can get multiple vaccines at the same time. A lot of patients come in getting the flu and COVID shots at the same time, flu and Tdap. So if that's something you're interested in, then let me know. As your pharmacist, I can make a recommendation to you as to what's safe to take together and what's best suited for you.
That's really awesome. Thank you so much.
Thank you for coming in.
Thank you, Wayne and Charlene. It's important. We want everyone to know about the practices that are going to increase our health and our well-being. Now, as we round the corner in 6 weeks into 2025, there are some things that are entirely new with Part D. Watch this next scenario closely as Lexi visits the pharmacy where Christian is working tonight.
Hello, Christian. I'm on Medicare, and I've been hearing some talk that my medications won't be as expensive next year. Is this true? I'm kind of dubious about these things.
Hello. Hello, I'm kind of glad you came in to ask about that. Yes, there are some big changes due to the Inflation Reduction Act. This act came into effect in 2022, and every year since then, there has been a new phase rolling out. As you may have already heard, during 2024, insulin prices were capped. So an individual taking insulin for their diabetes should only be paying no more than $35 for their insulin at the pharmacy. In addition, for this incoming year, 2025, there will be a $2,000 out-of-pocket maximum on their medications that a beneficiary will pay on all their medications.
Okay, so does that mean no matter how many medications I take or how much they're costing, once I reach the $2,000, I don't have to pay anything else, or?
That's somewhat correct. There are a couple important qualifiers. In order for those medications to be a part of that deductible, all of those medications have to be on the plan's formulary. So if they're not going to apply towards that $2,000 out-of-pocket deductible.
Okay, thank you. And I do have some trouble getting in contact with my drug plan sometime, my drug provider. So is there another way I could understand this, or?
I would really recommend you, every beneficiary should have a Medicare.gov account. From there, you can put all of your medications that you're taking or you might expect to be taking, and you can do a search to see what drug plans are out there and which one is going to give you the best deal for those medications. Compare pharmacies, compare mail order pharmacies, and that'll give you a good breakdown on how much you can expect to pay, not just monthly, but for the rest of the year.
Wow, that's
I wanted to add one more thing.
Yeah.
If you're not super savvy in the computer, there is a super awesome program, the Medicare Assistance Program, also known as MAP, and they're just super awesome. You give them a call, We'll get back to you as soon as we can, but we can help you with picking a new drug plan, going over your medications and many other options. They're fantastic.
That's amazing, Christian. Thank you so much.
Thank you.
Thank you, Christian and Lexi. Everyone we talked to is asking about how this new $2,000 cap is going to work next year. They highlighted the Medicare.gov plan finder, which Charlene's going to help us understand even further a little bit later. Right now, I'm going to explain this slide that answers another question that's being asked right now, which is who is paying for the amount that goes over the 2,000, since now we have this new $2,000 cap. You can see the different colors on here. The patient, the beneficiary, pays 100% until the cost gets up to the $590. That deductible amount is set by Medicare. Some plans choose not to go all the way to $590. That's another way plans can advertise and attract their beneficiaries. But in the red, you're paying for your medications until you've reached the $590. Then in that second column, you see that you're paying the 25%, and then manufacturers for some medications are going to pay 10%, while the plan kicks in with its 65% of the cost for that medication. But at $2,000, then you will be at the catastrophic coverage. So going to column 3, the government then is paying 20% of the cost of the medication. The manufacturer is also contributing, and the plan is paying 60%. So that's a brief breakdown. The next slide reminds us of those 3 phases as well. The annual deductible phase to $590, the initial coverage phase to $2,000, and the catastrophic coverage phase over $2,000. Some drugs do have the manufacturer discount and some do not, and there's some more details about that, but the bottom line is the donut hole has gone away. That coverage gap that used to exist when you and your plan had to meet a certain threshold of $5,000 and then you were in the gap for a while before you got out of the coverage gap, that is no more in 2025. So that $2,000 cap is in place when the drug is on the formulary. That's a really important qualification that Christian made. If your medication is not covered by the plan, then it is outside of that $2,000 limit. Okay, we are going to go back to the pharmacy. There's another element that's completely new to Medicare Part D in 2025 that's been referenced by the term smoothing. We're going to learn from pharmacist Robin and Kelly.
Hello. So I heard that there is a $2,000 cap on my out-of-pocket costs, and I'm super excited that it's coming up. But I am kind of concerned because from my understanding, I will need to pay, I take a lot of medications, it's kind of expensive. So I need to pay a lot at the beginning of the year. And then towards the end of the year, I basically don't need to pay that much. But with my limited income, with my set fixed income and also my Social Security, I am very concerned at the beginning of January, I will have a tough start.
No, I understand, and you're not the only one with that problem. So in 2025, the Inflation Reduction Act requires all Medicare drug plans and Advantage plans to offer Part D enrollees the option to pay for your prescription drug costs in the form of monthly payments instead of all at once at the pharmacy. So it's called the Medicare Prescription Payment Plan.
So how does that work?
So participants will choose the option where they pay actually $0 here today at the pharmacy for your covered drugs, and then the Part D plan will bill you each month for the cost of the medications that you pay for, and then your Part D plan will reimburse the pharmacy.
Oh, okay. So questions. So will it change the medication cost for me? And is there a fee if I do this plan thing?
Oh, heavens, no. There's no fee for you. So it will not raise your price, but it also won't save you any money. It just spreads it out for you.
Okay, that sounds good. So how do I enroll in it?
Like, you can sign up through your Part D plan, but you can also go to your Medicare.gov site. And when you log in there, it will give you a sort of a notification letting you know if that option would be beneficial for you or not.
Oh, okay. Thank you so much for your assistant. But last question. So this sounds like a good deal. I really hope that it's there every year. So will it be $2,000 from now on?
Unfortunately, no. With the
Oh,
Inflation Act, then there will go up every year based on inflation. But for 2025, you will be set at the $2,000.
okay. Understandable, prices are going up. But yeah, but thank you so much.
You're welcome.
Thank you, Robin and Kelly. We're so grateful to our pharmacy interns for these important answers. At this point, Charlene is going to show us some tips on Medicare.gov Live. That's an important place to understand the comparisons, the pharmacy preferences, and some of the new options now with this Medicare prescription payment plan as well.
Okay, can everyone see the Medicare.gov screen? Okay, awesome. Teresa?
Yes, thank you.
Okay, awesome. So as Christian and Robin and even Teresa have mentioned, you can go on Medicare.gov and there is a feature called the Plan Finder where you can find different Part D plans, Medicare Advantage plans, and compare them and see which plans are best for you. So you can either access it here where it says Find Plans. You can access it here as well. And in this bookmark bar, you can go under Health and Drug Plans. Under Find and Compare, there's also going to be the same link. And we're going to look at coverage for the 2025 year, and I've put in the zip code. And today we're going to be looking at Part D plans. You can also use this to look at Medicare Advantage plans and Medigaps. So do you get help with your Medicare health or drug costs? For this presentation, we're going to say no, but if you are getting any assistance from the state or SSI or extra help, then you would select those. But we'll just say we don't get any help. And a pop-up will ask you if you want to add your current drugs to this list. I've selected yes, and I've inputted some drugs to get a good variety of brands and generics and some of the popular drugs right now. And once you add in the medications that you're taking, you can choose the pharmacies that you want to go to or that you have the option of going to. So I always like to add a mail order pharmacy in order to just compare costs. And we can put in different pharmacy chains. So let's put in CVS. The specific location doesn't necessarily matter. So let's put in Save-On, Smith's, and Walgreens. It also works for independent pharmacies if you go to one as well. And so once you add your 5, then you can press done, and it's going to upload or it's going to show the insurance plans that are best fit based on the drugs that you're taking and the pharmacies that you choose. It's going to automatically sort by the lowest total drug and premium cost. So here it's around $1,500 for the year. And as you can see with the next plans, the price is going to increase. So right now, let's look at this AARP plan. So if you want to look at more details about the plan, it kind of shows a screenshot here with the premium, the deductible, and how much you would be expecting to pay in general. But you can look at the plan details page and it's going to show the screen. One important thing to note in this top dark blue bar is your monthly premium, as well as how many drugs how many drugs that the plan covers. As you see, it covers 7 out of 7 drugs, which is really great. We've talked about the out-of-pocket maximum being capped at $2,000. So if all 7 drugs are covered, all of them count towards this $2,000 maximum. So these are the drugs that we've inputted. These are the pharmacies that we've inputted, and you can see which pharmacies are in network. You can see if there are any that are out of network. And from the in-network ones, we can see which ones are preferred by the insurance plan. And this shows a breakdown of the drug costs that you would pay per year, and it breaks it down by every drug. So as you see, some of the brand name ones are quite expensive compared to the generics, like losartan and amlodipine. And on the bottom, it shows how much you're going to be expected to pay in the drug costs every year based on which pharmacy you decide to go to. Here's the pop-up where it says the Medicare prescription payment plan, and you can see if this is right for you. We'll go into that in a little bit. With the $89.10 premium per month, this is accounted into the total cost that you'd be expecting to pay. So in that first screen, that's where you saw the $1,500. And here is a very important point to see the breakdown of the total monthly drug cost per year. So as you see in the first 3 months of the year, this is where this patient would be paying for their medications. And then for the rest of the year, they would pay $0. And that's just as they're going through the different coverage phases. But as we talked about in some of the scenarios, not everyone can afford to pay like everything up front. So if you go back up to here, where it says Medicare prescription payment plan, you can click on this, find out what your drug cost might look like with this payment option. You can click on that, and it'll open up a screen that'll show how your monthly bill will be calculated. Again, the Medicare prescription payment plan is paid directly to your insurance plan, and you wouldn't pay the copays to the pharmacy directly. So for this, let's pick a chain. I'm going to pick Save On. And you can see that without the payment option, you'll be paying the majority or everything up front in the first 3 months and not have to pay anything for the rest of the year. But with the payment option, the costs will be spread out throughout the year. So you'd be paying a consistent $27, $28 a month for the majority of the year. But the total out-of-pocket cost that you would be paying doesn't change. It stays the same. It's just distributed a little differently. You can use this to compare other pharmacies as well. And based on your situation, the medication prescription payment plan may not be right for everyone, but this is a good tool that you can use to figure out what fits best for your financial needs. And here for estimated drug costs, it'll give you a blurb that says for 2025, you won't pay more, or you will pay more than $2,000 out of pocket, or you won't pay more. But this will kind of give you a summary of how much you'll be paying for each drug that you've selected. On the star ratings, this is just based on different characteristics like customer service, member experience. It's very rare for a plan to have 5 stars, but it's just to get a holistic view of if that's something that you want to look more into. But if you click on view more drug coverage, you get to see based on the type of drug that it is. So if you get a new prescription at the pharmacy, or if you get a new prescription that you need to pick up, you can kind of get an estimate of how much your copay would be at the pharmacy, depending on what kind of drug it is, if it's a generic, if it's a brand. So something to look out for. But under other drug information, an important thing to look out for are these two columns. The first being prior authorization. If any of your medications requires a prior authorization, that is something that is really good for you to talk to your doctor about. For this Mounjaro, for example, if you don't get a prior authorization on the Mounjaro, you're most likely not going to get it approved. So if you talk to your doctor about it, the doctor can then provide additional information to your insurance company about the diagnosis and other important details to make sure that you get it approved and to make sure that you get your medication in a timely manner. And then the other thing is quantity limits. You can see that for the majority of the medications on the list, they have a quantity limit of about a month. So, but for like the losartan and the amlodipine, there's no quantity limits. So that's important to know which drugs can you pick up 3 months at a time? Which drugs do you have to come in and pick up every month? So this is one of the ways that the plan finder can really help you determine what your needs are in terms of an insurance plan. So you can actually use this to compare it with other plans as well. We're going to see one that actually has a higher total drug and premium cost. Where is it? There it is. So the Cigna plan, almost $11,000. So if you click on Add to Compare, you can compare the two plans side by side to see what the differences are. So yes, you're going to have a much lower monthly premium in the Cigna than in the AARP, but you also have a $590 deductible, whereas the AARP has a $0 deductible, and only 6 out of your 7 prescription drugs are covered. Again, if you have a drug that is not covered with your insurance plan, you would have to pay the retail price for that medication. So let's look into the plan details of this other insurance plan. So you can see covers 6 out of 7 drugs. These are the drugs that we've inputted. And we also have a pharmacy that is out of network. So if you go to a Smith's, definitely something to look into when you're trying to figure out if you want to use this plan or not. And the Brez tree is not covered. So it shows a $9,000 payment per year rather than what it was before, which is much lower. So, and for the pharmacy that's out of network, you'll see dramatically increased costs. So this is why this tool is super helpful. And you can see the breakdown of the estimated total monthly drug costs. This is very, very substantially different. And so if you look at the Medicare prescription payment plan though, let's look at that Save-On that we looked at earlier. You'll see that the total amount for the out-of-pocket cost is still listed at $1,500, $1,588.35. But that doesn't include the Brez tree that is not covered under your insurance, which is why it's really important to make sure that all of the drugs are on the plan's formulary that you choose.
Charlene's done a great job of showing how Medicare.gov can be very useful. There's a lot of potential for you to learn things for yourself within your own Medicare.gov account. Thank you, Charlene.
Thank you. And one more thing, once you compare your plans, you can choose to enroll in them, and there's a couple of steps and you need to provide some additional information, but during the enrollment periods that you're eligible for, you can enroll in a plan directly through the website as well, or you can get assistance from MAP.
Thank you. Great job, Charlene. So we have a final part of our presentation this evening. We just are not ready to let our pharmacists go yet without asking them a few more questions. We're eager for this time when they're with us, and we have a few more questions that they're going to answer.
Yes, sir.
So many pharmacies have member cards, and I think we've all heard about GoodRx. Can you explain how that works with insurance?
Sure, I'll do my best. GoodRx is one of those coupon or discount programs out there. There's a bunch of them. I know GoodRx. I can't remember all the other ones off the top of my head. So they do help lowering your prescription drug costs. One important thing to know though is if you do use a discount card such as GoodRx, you're electing to go outside of your insurance. In addition, if you go outside of your insurance using that discount card, while it might lower the cost of your medication, that drug is not going to count under your $2,000 deductible. So it just really depends.
Thank you.
You're welcome.
Yes.
Hi, just a quick question. I'm curious. So when there's an over-the-counter option available, but it's also can be written as a prescription, is there a pharmacist opinion or policy on this, whether which one is better?
Yeah, that's a great question. So your prescriber might take something like a product like ibuprofen that's available over the counter and write a prescription for you for that product. And there can be some benefits of filling that as a prescription. One, sometimes an over-the-counter drug that's available to you to just purchase off the shelf has higher strengths or different ways that it can be prescribed when a prescriber writes it. So ibuprofen is available up to 400 milligrams to take as a dosage over the counter. When you get a prescription for it, you can double that 800 milligrams because you're under the care of a prescriber who might be able to check you if you're going to develop an ulcer from something that high. So we don't say use it that high over the counter. That said, sometimes a prescription that you received for an OTC item isn't covered under your insurance because it's an OTC item. And so sometimes that's where you might be directed by the pharmacy to go ahead and just purchase it over the counter, or they can still run it as a prescription, but you might pay the quote unquote cash price, but sometimes that's less expensive than it was to purchase it over the counter. Another benefit of filling that prescription or filling that over the counter item as a prescription is that it's now part of your profile that the pharmacy can see. So they can check if other prescription medications that you take or add might interact with that product. If you just buy it over the counter, we won't ever process it as a prescription in the pharmacy, and then we won't know if it interacts with any of your other products. So just some things to think about if you receive like hey, this is vitamin D over the counter. Do I need to fill it? I can just buy it off the shelf. It might be a different strength vitamin D that's not available over the counter, or you might be able to kind of then check it against your other medications if we fill it in the pharmacy. Or the pharmacist might say it's going to be better cost effective for you to just go pick this one up off the shelf.
Me.
Sir, how can I help you?
So can you please explain why some of my medications are covered under Part B and some are covered under Part D?
Yes, I think we get this question a lot in the pharmacy, especially when you have different deductibles for both of those items that you have to hit. So it seems like it's more expensive. Part B is preventative services. And so some of your medications or medical equipment are preventative. Testing strips, that's preventative from you going into ketoacidosis or having a major medical issue. That's covered under Part B, as are some of your chemotherapy drugs and some vaccinations that we heard from Charlene earlier today, and some prescription medicines that go with a medical device, like a nebulizer, a solution if you're getting albuterol. Those all go under Part B. Part D products, those are ones for treating immediate illnesses and ailments or still preventing some issues, right, with blood pressure and things like that, but they're not considered full-on preventative services.
Thank you. That was it. So Teresa?
We never end any conversation or any presentation without saying that please guard your card. We will always want you to be aware that Medicare fraud is definitely something that happens. And so this is the slide that reminds you to treat your Medicare card like a credit card and keep that number safe. we're really grateful for the opportunity that we've had to have the grant from Dignity Health in order to fund our call center for the last 4 years. It's a privilege to be able to assist these beneficiaries. The next slide shows that Vanessa referred to the grand reveal of our $2.8 million over this time frame. And we're proud that we've been able to do that. It's through pointing them to subsidy programs. It's through showing them that there's a cheaper Part D plan. It's through helping them realize that there's manufacturer programs that pay for some of their expensive medications that aren't covered by the Part D. So that's the rewarding part of what we do. And everyone that we talk to is an individual story. It's a privilege to be able to listen to them, take the time to hear their stories. They are you, they're your parents, they're your children. And we love to have the opportunity to take the time to hear their story and provide a solution from the experience that we have. Those are our phone numbers. You're welcome to call us, to tell your friends to call us, tell your family to call us. We really do consider it a privilege to help you. And now you still have the opportunity to ask further questions. We had some staged questions that we provided for the pharmacists that have been there this evening, but you are at this point welcome to ask other questions that you may have thought of during our presentation.
And I will add, you know, a difference between calling the MAP program, whether you call Roseman or the state program, is we are not brokers. There are some fabulous brokers out there that help and navigate this system for many seniors in the state, but we don't get any kickbacks. So that 2.8 million that you saw, that is just what we try to calculate if we get a patient onto a plan and now they can afford their medications, or like Teresa mentioned. So we're not, we are very unbiased, and our training from CMS is state approved, and it makes sure that our students are getting you the right information along with our counselors, Teresa and Wayne.
If you're married for 10 years, then you're eligible to get your spouse's Medicare, even if divorced. But is that true even if you've not, would you have to pay a Medicare Part A premium if you had not personally worked for 40 quarters, even though you're getting the Medicare through your spouse?
Okay. So if you have been married to your spouse for 10 years, you're basically using their work credit. So no, you as the spouse do not have to have personally worked for those work credits.
Thank you.
Yep.
Anybody else have a question? Sure.
I have a question on health saving account. I might be unique because I have been taking care of my health naturally through diet and exercise. So I don't take any medication, but I will be eligible for Medicare in a few more years. So today lecture looked like that I should pick plan A for my benefit, because I don't do hospital, a lot of things too. And so I don't. And then with health saving account, so I can hire my own people to change my diaper if I need to. So how does that work?
Actually, Teresa, you want to take that one? Because I know you have a lot of experience with the HSAs.
The thing to be aware of when you are contributing to an HSA or your employer is contributing to an HSA is that you need to stop that before you join Medicare. For at least, there needs to be at least a 6-month gap, or there's going to be a tax penalty. That's because both of those are considered insurance. Medicare's insurance, a health savings account, is a kind of health insurance. And so you're not allowed to have both of those at the same time without incurring a tax penalty. So if you are knowing you're going to go to Medicare, then you just stop your donations 6 months prior to your 65th birthday, whether you're going to take A and or B. As far as having a lifestyle that may not need medical intervention, that's your own, that's a personal decision if you're going to pay for Part B or not pay for Part B, just always knowing that if you don't take it when you're supposed to take it and you need it later, you would face a penalty for having delayed that time.
Just an example there. I love that you are taking care of yourself holistically. We encourage that as well. If you don't need to be on medications, we don't want you on medications. However, should you be diagnosed with something in the middle of a year where you're not in an open enrollment period, you could drain all of your savings trying to pay for chemotherapy or trying to cover costs of medications that would be way above if you were going to elect that route. And so that's just something to think of. You might have a really great nest egg. And so you're like, I don't need it right now. And I'm very healthy, but there could be things that come up 10 years, 15 years from now that could cripple those savings. So that's just something to think about if you opt out. You can always join again, but there could be delays.
Should get plan B. If I don't get plan B at the beginning, I get fined.
Yes, if you do not take Plan B when you're eligible for it, you would get fined, not fined, but you pay penalties when you try to get on to Plan B. And the same for Part D later on. Yes. I'm just going to give that to Teresa.
I'm sorry, so if I take plan A only with my health saving account, and so I cannot contribute at all when I go on Medicare? Oh.
So let me just kind of clarify a couple of things. First of all, let's refer to those as parts, Part A, Part B, because when we talk plans, we're usually talking about Medigap policies, the supplemental policies. So we are right now talking about Part A, Part B. Yes, when you are, you can no longer contribute to your HSAs if you've enrolled into Medicare Part A, Part B. Otherwise, what Teresa was saying about the tax penalties. So you definitely want to stop any kind of contributions to HSAs prior to beginning your Part A and Part B.
How much prior?
At least 6 months. At least 6 months. Now, on the Part A, because it's already premium free, you don't really have to worry about any kind of penalties. What we're talking about for Part B is if you don't enroll during your first 7-month window, your initial enrollment period, when you can enroll, if you don't enroll during your initial enrollment period, you may not be able to enroll in Part B when you want to. You would have to wait for the general enrollment period. Depending on how that timeline works, by the time you enroll, if you've gone a full 12 months without coverage when you could have had coverage, you will start incurring penalties. It's for every 12 months. For Part B, it's a 10% penalty that's added to your monthly premium for the rest of your life.
Yes, I have a generic question about insured or payer non-compliance. When they, for example, I've been waiting 14 months and 5 applications for prior authorization. So they haven't said no, but it's already been over a year. What recourse or who does one go to outside the plan for when that happens?
Yeah. So one, you're probably already doing this if it is a drug that you're trying to have
Yes.
covered, not necessarily, but you can have prior authorizations also required for service surgeries and so on. But if we're talking about medication, so you're checking in with your pharmacy, and just because you have that are helping you out, we can kind of give you a backside. We see the prior authorization, but we can't submit the prior authorization. The healthcare entity who can submit that prior authorization is the prescriber that wrote it.
We understand.
Right? And so that prescriber writes it, it goes to the insurance company. Teresa, I am blanking on it, but there are some quality assurance programs, Levanta, that
What's
you can
that?
reach out to if you feel like
What's
it's
Levanta, or what is Levanta?
Levanta is the QIO, the quality insurance.
Is that a state or federal or what kind of organization?
It is federal. And so we don't have one in the state like ours is in Washington or Oregon or something like that, but it covers the
It's
Western
regional.
region. Correct.
Okay.
But yeah, it's the quality insurance organization.
Also, is that the same organization? My Plan C has assigned me a primary care doctor and refused to pay the visits.
I'm sorry, say that again, please.
They've assigned me to a primary care doctor and they won't cover the visits. So
That
I
would-
keep getting sued by the primary care group.
That would also be a Levanta.
Okay,
yeah,
that's
that
what I'm
would-
asking. Thank you.
Definitely. go there for that appeal or that process to get assistance.
Yes, that's an advantage plan. And so that's kind of, Teresa highlighted this at a high level at the start of the presentation, where an advantage plan can be sometimes more restrictive. It can be less out of pocket, but it's more restrictive to the providers, the services, sometimes the drug formularies if included, compared to a standalone plan that might be accepted by all providers for you. So that's a good example where it can sometimes hinder care.
Non-compliance a high incidence, or is it considered rare?
Non-compliance?
Say, well, you're covered in the literature, but when it comes to pain, they don't. I don't find it to be that common. I'll just be quite honest. They don't.
Yeah.
I find that, you know, you can't sign on when you sign on to it, then second year, you want the rest of their lives, that kind of forces people to, oh, otherwise you get fined, do it now.
I think it's a kind of a checks and balance to making sure people have coverage in the right time and they can budget for some of those costs, right? So you put off kind of, it's insurance. So if you're not paying any of those premiums and deductibles and over the course of year over year over year until you really need it, that's kind of how insurance works, that there's money to work on for other people that need it. And so if nobody signs up when they're supposed to sign up and they're healthier and they only sign up when they're really sick, the insurance plan doesn't have enough funds to operate.
There's a question up here. And just note that if you don't have a microphone, no one on Zoom can hear you.
Yes, quick question. My husband will be turning 65 next year. I'm still working. Can I still carry him on my private insurance? Does he still have to register for Medicare Part A, even though he's on my private insurance?
The recommendation would be yes. Wayne or Teresa, I don't know if either of you want to take this one. Teresa, would you like to answer that question?
Usually there's no reason to not take A because it becomes secondary even when the primary insurance is the employee coverage. That's great that you have the coverage to cover him, but there's usually not a reason other than that HSA reason that we referred to not take Part A. And then yes, you can absolutely, he can defer his Part B until the employer coverage is no longer an option. And at that point, he'll have a new enrollment period to get his B.
With no penalty to register for B later?
As long as you can prove that he had coverage, that the onus is on the beneficiary to be able to show Social Security. Yes, I'm now 70, but for the last 5 years, I was covered by this. I have this documentation from my HR department to show that I had creditable coverage for those 5 years.
That's also for the drug. So the credible coverage for the drug coverage as well. So two separate entities to make sure that the drug coverage is also credible because those penalties hit for Part B and Part D.
Part D, okay.
One other thing about that, in addition to not getting a penalty, as long as you can provide credible coverage for both you and your spouse, if you decide that you want to keep original Medicare, you do have a guarantee issue right when you first enroll into Part B because you've deferred Part B. You have a guaranteed issue right for a Medigap supplemental policy. But unlike when you enroll at 65, you have 6 months to do so. When you defer Part B, you have 60 days of a guarantee issue right for a Medigap policy.
Guarantee is where they can't charge you more for certain diseases or certain health conditions and so on your plan. They can't penalize you for that or deny it completely. Yep.
Do any of our guests on Zoom have any questions? Feel free to put them in the chat or you can unmute if you'd like. Okay.
All right. Well, I want to give a huge thank you to Teresa for joining us. She has a child expecting pretty soon, so that's one of the reasons that she's on Zoom and not here in person. She was so sad when we had this date and then her daughter decided to bring more life into the world that she couldn't be here in person, but we thought this was a really happy benefit or happy medium because she's so knowledgeable and such a great resource. And then just thanks to the students and Wayne, and we have some state representation here as well with Matt Vinsko, and just want to thank you guys for being here.
And the Academy Award goes to Wayne and Kelly for tonight.
All right, we have about 15 minutes. So if you have any personal individual questions and you want to come up and ask some questions, you're welcome to do so. Otherwise, thanks for coming tonight. Teresa, we're going to take a quick picture with you on the screen.
Okay.
All right, Teresa, I don't know if you can see us, but we're taking a picture with you on the screen. We're just getting.
Sounds great.
Get in, yeah, oh yeah. Present her photo. I know, that's because if I pull her, well, maybe now that everybody's off.
Yes, Levante QI. How do you spell Levante? All one. And okay, so I want to do that. And also with maybe the one.
Even if I pin her.
I don't want to have reasons against particularly 12. No, no. Okay.
I just didn't want to cover the title of what you guys were doing. I could bring her down, you're right, because I can pull it down without with covering what we. So like right here. Is that better? Can we steal them for Jess because we can get Teresa off the photo? No, we want you in it. I'm sorry. Thank you.
Okay, sorry. No, so, I'm sorry.
Thank you. Like that? I see. Right. Oh, there you go. Get two hands.
I think your hand is broken for sure. My hand is small.
Just. I didn't have any short on the side.
Oh, that is.
Yeah.